This is the Digital 2.0 Modern Digital Executive Interview Series. With me today, I've got Dr. Ray Gensinger. Ray, thank you for joining us today.
My name is Ray Gensinger. I am an internal medicine physician by training, but actually serve as the Chief Information Officer for Hospital Sisters Health System. Been here 8 years with this organization, actually trained here when I was a medical student. Came back to home, so to speak, in order to help this organization transform. Very interesting piece of tidbit. Most people wonder what's a physician doing as a Chief Information Officer. There's just a couple of us out there. But really, I think it has to do with if we're going to try and transform healthcare from the ground up, and technology is going to be foundational in that. It really feels like physicians and other clinicians, nurses, et cetera, should be part of that leadership design team.
Absolutely. And it's really using technology to enable people, right?
Mm-hmm.
And
absolutely.
Better care.
It's about making the patients better, but it's all about putting more and more tools and efficiency in the hands of the people that actually have to deliver the work. I don't dismiss the importance. The nurses do 90% of the hands-on care. We need to do everything that we can to make their lives more effective and efficient. And the physicians that stand behind them that are making all the decisions need to have as much information and knowledge at their fingertips as well.
That is a perfect segue, actually, because I want to kind of dig into that. So you've done a lot of this work over the years of helping enable people. As you've gone through those 35 years now, what's some of the biggest lessons that you've learned from transforming these organizations and helping enable people?
One of the most important lessons is we refer to don't pave the cow path. And that is to say that if all you're doing is layering the technology on top of the work that you already do today and not actually taking the time to rethink how that work needs to be delivered, then you're going to really run yourself into the ground. And I'll be honest, I've been an executive that's done that. We follow the path of least resistance. And in many cases, part of the challenge is that while we're a very expensive and a very large industry, we don't have a lot of expendable resources. We don't have a lot of expendable dollar resources, and we don't have a lot of expendable people resources. And therefore, what oftentimes is you just try and figure out what's the quickest path from A to B. And you don't take a whole lot of time to figure out how to optimize or improve or redesign the process that you're working on. And if you look at healthcare and you look at how you take care of yourself or how an appointment works, it's no different than when you were a kid, right? It's the exact same process. We've just added some automation around the edges, but otherwise it really feels the same, with the exception of how I think things have really transitioned over the course of the last, probably started 7 to 10 years ago, but really we're seeing the majority of that transformation really starting to take place here as few as the last 24 months.
There's been a huge amount of change in the healthcare industry across
Absolutely.
the country and through the world over the last 24 months. Yes, the pandemic has affected a lot of that, but it's not just been the pandemic that's done it. It's a change in the patient behavior.
I think it's partially the change in the patient behavior, but I also think it's part of the pressures that are coming from other industries getting their feet more into healthcare because they see an opportunity and they're going to take advantage of those opportunities as best that they can. It adds an interesting challenge to the work that we are doing, but it also creates a competition that didn't necessarily exist 5 years ago. So up until 5 years ago, we could ignore it. I'm here in Springfield, Illinois. It didn't really matter to me what Gensinger did or what Cleveland Clinic did or what BJC down in St. Louis. I started to pay a little bit of attention to. Memorial around the corner was somebody that I always was paying attention to. But now I got to worry about Apple and I got to worry about Amazon. And I got to worry about Google. Those were never things that anybody would ever think that they would ever have to compete against, right? And now I'm competing with them in healthcare as well. Not just for services, for people in some cases. That's part of the challenge.
That's been one of the biggest challenges over the last 24 months. You actually hit something there just because Apple, Amazon, some of these larger companies out there, they have the ability to reach into our organizations and change the way we have to do things, because they've found a niche or a need, or somebody got somebody hired and created a new product for it. What does innovation actually kind of mean to you at this point? These bigger companies are starting to do it for you instead of, especially in the healthcare, innovation has a much different definition than a lot of other industries. How do you actually handle innovation and trying to push the envelope in your own journey?
So we break down innovation into two elements, right? There's capital I innovation and there's small I innovation. And for me, most of the innovation that we're working on in our industry is just making sure that I'm ahead of the people down the street, right? I don't have to be doing anything that's going to knock the socks off of the industry. I just have to be a little bit faster, a little bit more nimble, and a little bit more appealing than my competition down the street. Now, we're in two different states and a number of different cities. So there is different competition in different marketplaces. So we have to pay attention kind of on a broad perspective. But for the most part, that is most of who I'm competing with. That is affordable innovation. Now, the capital I innovation is about doing something completely new and different. Thinking about delivering a service in a way that's never been done before, or delivering a service that's never been delivered before. And I think that the challenge is that's what these other technology industries or the other technology companies can begin to do. They can start to compete with me because in the digital world, we are right down the street from each other. And those organizations have deep pockets and they have diversified revenue streams. Most healthcare systems 10 years ago had one revenue stream, right? That was providing care. How many other industries or business in the world have their payments absolutely controlled by either the federal government or by very large competitors in some ways when you think about health plans, such that I don't have a lot of diversification. I don't have a lot of ability to generate new revenue, new capital in order to be very innovative as an industry. We're struggling with that as a company, but then I think that's a big problem that many health systems are having. And what you're seeing is some of the biggest health systems now are really starting to diversify. They've got their own investment portfolios. They're investing in companies rather than contracting with companies to do work. They're investing in those companies to do work for them. Very different space.
So you're seeing that as almost a change in the way that you approach your transformations for these organizations then going forward.
In some ways, yes.
Instead of buying the service, you're actually investing in the organization so they become part of your organization.
Exactly. And I mean, there are places like UPMC, they've been doing this for years. I think Mayo has been doing this for years. You know, if you're a good enough company for me to spend tens of millions of dollars on you to do me a service, why not spend tens of millions of dollars to own part of your company? I mean, it seems like a lot more sensible way to approach it.
So we're talking a lot about the current state right now, big changes that have happened over the last couple of years, but you're looking to the next, let's call it 5 to 10 years. What do you think some of the biggest things that are going to come that's going to change the way you approach transformation services, innovation, and really just your biggest piece here is keeping ahead of the competition and having that one step ahead mentality?
Yeah, the healthcare economic model has to change completely. It has to change completely. You know, where the different payer sources have the ability to drive the price down to the absolute lowest cost, as opposed to the people who are trying to provide the service being able to try and set it appropriately, is killing us. And I'm not going to try and defend the fact that, you know, we're spending 18% of our GDP on health at this point, not necessarily getting the outcomes that other countries that are spending less are getting. But a lot of those countries that are spending less and are doing better have very different economic models as well than we do in the United States. And they've got very different legal situations as it comes to what has to be done in order to protect ourselves from the legal risks. So I think what we're going to do is in order for healthcare and the large organizations, you're going to see the whole revenue model for some of these big organizations to change. And that's, like I said already, you know, you see Providence doing this. You know, first we did medical tourism, right? So some of the biggest systems, they went over to the Middle East and they built whole cities of healthcare systems in those cities, and they brought people back into the United States, and that worked for a while. But I think at this point, if you really want to innovate, you're going to have to figure out how to bring a new revenue stream into the organization. And so they're investing in companies, they're investing in resources to provide professional services to other healthcare systems. You're seeing collaborations form that never formed before. Everything that we can do in order to bring in additional revenue via new vehicles in order to turn that around and make the investments in the technologies, innovations, transformations that really are going to need to be there to make a difference in the long term.
The economic model is probably going to be the harshest thing for us, right? And we're seeing some of the cool stuff I've seen even in the last couple of years is we've seen all the acquisitions with health tech startups, right? There's a lot of them happening in the last 24 to 36 months, but there's always another one starting up the next day. So it's really the same kind of concept, though, is that economic model has been shifting. Instead of the hospitals and hospital groups and care groups doing it, you're starting to see the startups, which are being funded by them.
Correct. It's both. It's being funded by them and or being funded independently. And it's just, trying to keep track of them is mind-boggling. It's been an exercise that I've got a couple of my staff members working on to try and figure out how to address this as well. If I wanted to know how many companies are out there offering apps that do online scheduling or apps that do text messaging of appointment reminders, there's got to be thousands. We've gone from a best of breed industry that might have had a couple hundred companies. And then we kind of got these monolithic healthcare service providers, the big EHR companies of the world, so you might have still had hundreds of applications, but the majority of your work was being serviced by 8 or 10 applications. And now we finally got those figured out, and they do 90% of what we need, but that last 10% is really important. And that last 10% is what the new consumers want. Suddenly, that little percentage becomes so relevant that we're augmenting everything that we've built with all of these little tiny integrated apps and applications, and just trying to figure out how to put all those pieces together, how to make the right bets so that that company is still there 2 weeks after you sign the contract. It is a whole new set of complexities that we've been really challenged by at this point.
Absolutely. It's been an interesting show, at least, seeing all the new startups and new technologies that are coming out, right? Like you said, planning and scheduling, billing through RevCycle to even just telemedicine. Seems like there's a new work there every day, right? So
I just laugh. I mean, telemedicine, I think, was the first technology innovation I worked on back in the 80s, when suddenly AT&T brought broadband to the world and everybody was put in video conferencing and, video telemedicine services, and, still took 35 years in order to kind of get to a point where it actually can meaningfully work for patients and in a way that it never could before.
We talked a little bit about the past, the current, and the present, and a little bit about the future. In the broader scheme of things, in the world and the global economy here, who are some of the companies that have surprised you the most with their transformations over the years?
It's funny because as much as I don't want to talk about them, I'm going to mention Amazon. It's inherently obvious, but the thing that I've noticed in the last 3 months, Geremy, is that I suddenly realized I would go to Amazon and pay 25% more for a product that if I just went and Googled it or just went to the store, I could actually pay a fraction of the price of what it was being listed on, because I had become so addicted to I need new spices. So I need Tuscan spice. So I go and I get online Tuscan spice. Oh, there it is. It's $27 a jar. Click. I bought it, and I had no idea that at the Myers down the street, it was $5.73 or something like that. They've just got us. I mean, they've made it so easy. And so many of these industries, the other one is travel and leisure. Have you ever rent a car where you actually had a sign like 27, the report that you printed out was, 27 pages long, and you had a sign on all 27 pages in 16 different places. But now I get on booking.com, click. I've got a hotel, I've got my air, I've got my car. All I have to do is show up and with a credit card and ID and all of those things. And you know what? And every one of those industries saved money because they cut out all kinds of crazy people that needed to process all that. And they made us happy because it cut out all the time and aggravation that we needed to put into that. That's the same thing we need to do in healthcare. We have to, there are so many steps that drive people nuts that I spend a lot of money putting people in place to do. And we have to figure out how to cut out each of those different elements.
They weren't huge changes. The transformations they made were really small interaction changes. I mean, I keep on saying this, right? We make little changes over and over and again. Eventually, the ripples out, and you have a big change throughout the time. We got a little bit of fun for you. This is really just hype real or WTF for us. Mm-hmm. Just tell us your first opinion on them. AI, hype real or WTF?
Oh, totally real. Absolutely real. We're going to screw it up 8 or 10 times on the way there. And some of those screw ups are actually probably going to harm people, which is really kind of scary. But once we get it figured out, once we get it organized, this is going to be the new way to provide care. Going to be the new economy, I think, data and what we can harness from that. The faster we get through it, the more money is going to be made in that space.
100%. Mm-hmm. Okay, the metaverse.
I'd like to call it what the F, but I'm going to call it real. And that's because I had a conversation with a person the other day, and it's like, it's the only place where you can get everybody together, where you can get your grandparents and your kids all to be able to kind of interact. I wish I didn't have to be there, but I don't know how to get out of it.
Okay, I'll give you that one. I still look at that and I can't understand it, but yeah, I get it. Mm-hmm. All right, crypto.
WTF. Believe it or not, I'm my background is in environmental sciences, is where I started. And I think when we figure out what the negative environmental impact is of managing crypto and what we are doing to the environment because of this is going to be mind-boggling. And it's probably all the people who play in this space the most are the ones that when they actually figure it out are going to realize, what the heck, we got to dump this.
Oh yeah. My fun one, Elon Musk.
Whatever you think about this guy, he is for real. All right. He has reinvigorated manned spaceflight. Okay. I mean, we were just kind of shuttling people back and forth to the space station until he actually figured out how to make, reusable rocketry. It's changed, completely changed, right? We didn't talk about going to Mars before he started getting involved in this. Think about what he's done with Tesla. All right. And was there any real push to move to electrification of transportation before he showed up and put those cars on the street? Right. And I think he single-handedly has made a huge difference in our country's economy and where we're going to head from a transportation industry than anybody else has.
We're definitely going to dig on that because I feel a lot the same way. Starlink's still one of my favorite things in the world right now.
I like it in concept. Everything I'm reading about it is just it may have a lot of negative implications. When they start running into things up there, I'm going to be a lot more worried about it.
All right, last one, remote and hybrid work.
This is the real deal. This is what our employees want. I mean, from the day I started in my current company, my employees asked when they could go home. I think companies that went big bang to remote versus those companies that have evolved to remote are going to be in very different places. We sent our people home big bang at the beginning of COVID and just brought people back for a social event for the first time in 2 years. And I mean, people were crying at the happiness to actually get to see people who they hadn't seen before. But I think it's here to stay. And I'm not sure what that's going to do to us as a society and the social interactions. And I mean, we're a social species. And so I'm not sure the long-term implications are going to be if we create a work environment that individualizes us. And I don't know that Zoom's going to do it. You and I are looking at each other, and that's better than just, hearing each other's voice. I'm an introvert and I like my alone time, but I want to see people. I want to get out and do things. I want to have a beer. I love to walk the halls. That's the way I lead. Well, you know what? There's nobody to talk to anymore when I walk the halls.
The drive-by conversation is lost. It's so painful. I'm the same way.
Well, and what my staff is saying is they feel like they're working so much harder than they ever did before because their day doesn't have anything to break it up. It's just Zoom meeting after Zoom meeting anymore. And or they're working tickets or working on projects, things like that. They feel that loss of social interaction.
Sadly, we've come to the end of our time. Dr. Ray Gensinger is with us. I appreciate all the time you took with me today. This has been an awesome conversation. Before we kind of break for the day, love to give you an opportunity. Tell us a little bit what you got going on or how they can get a hold of you if you'd like to.
I'm easy to reach. I'm just ray.gensinger at hshs.org. That's the easiest way to reach me, as long as you're not selling anything. We've got a lot going on. We've got a lot of our core work done, but we are actually investing at this point in time, Geremy, in that transformation and the small I innovation, but keeping our eye on the large I innovation. We understand that we have to redesign healthcare. And one of the things that we've been pitching is that I'm not redesigning healthcare for the elderly, frail, and sick of today. I'm redesigning healthcare for the 40-something-year-old guy who's never gone to the doctor. And I'm redesigning healthcare for the 20 and 30-something woman who's looking at obstetrical care or is managing the care of their children. It's a very different place than it was. And I think that's the biggest transition that we have to undergo is that we have to understand who we're actually marketing to. And once we figure that out and then figure out how to pay for it, I think we're actually going to start to see the momentum that we need in the transition. And I'm excited to still have about 10 years left in my career and an opportunity to do that.
Can't wait to see what else you get done in the next 10 years then. Ray, it's been a pleasure. Thank you again for joining us.